But our first speaker is Charles Feldman. Charles is an amazing advocate for mental health services and for mental health patients in the state of Rhode Island. He's chair of the Mental Health Recovery Coalition, and he just does amazing work. And as I'm sure most of you are aware from reading about not only the bill passed in the House of Representatives, but in the Senate bill, that people with mental health and substance use disorders are a real risk here for losing Medicaid, but also losing the benefit or the required benefit that mental health services be covered in their plans. So with that, here is Charles Feldman.
Hello, everyone. I forgot what we won.
Healthcare!
Who do we want it for?
Everybody!
Great. So I guess I'm in the right place.
Yay!
Okay, I am a person in long-term recovery from a major mental illness. In both my work and volunteer work, I support people living with mental illness so they can obtain recovery. Recovery is real, and people with mental health and substance use conditions can go on to lead meaningful, productive lives. But this can only happen if society provides the resources to allow us to move on in our lives. These resources include access to health insurance, including Medicaid and Medicare, which allow people with major mental illness to receive psychiatric services, case management services, supported employment, supported education, and peer support services. There was a time when I used clinical mental health services 7 days a week, but now I only use them a couple of times a year. If those services had not been there for me in the early days of my recovery, I would not be where I am now. When the Affordable Care Act was passed, Rhode Island took advantage of the Medicaid expansion to allow people to receive services that they would have previously been denied. In my work in the mental health field before the ACA, I would often come across people who were in crisis and who were uninsured, and they would have long wait times to see a psychiatrist, if they could see one at all. Their situations would end up worsening due to not having access to treatment. The Medicaid expansion changed that, so that now, at least in theory, everyone in Rhode Island, though they may be homeless or unable to navigate a complex insurance system, is eligible for Medicaid. I can talk a little longer than that. Mental health advocates have worked to bring about mental health parity. The parity laws that we have mandate that health insurance policies include mental health care to the same extent that they include all other health care. This has been found not to be a burden on the insurance companies at all, but it allows people with mental health conditions to realize their full potential. The bills that attempt to repeal the Affordable Care Act would take us back to the days when mental health care services were not valued and people would more easily fall through the cracks, leading to extended crisis rather than recovery. The bills that are attempting to repeal the Affordable Care Act would cut hundreds of billions of dollars from Medicaid. I have a friend who lives with mental illness who is in a nursing home for other physical health reasons. She is worried that Medicaid, which covers her nursing home care, will not be there in the future. Here is a case of someone who, at the moment, is unable to live on her own and needs daily supportive health care. She is hoping when she resolves her physical health problems to be able to live more independently. If she had not been able to access the medical services she has used, who knows if she would have even survived. Medicaid has been the resource that she has used to be able to pull through her medical challenges. Medicaid has helped people in the community with services like homemakers, home health aides, personal care attendants, and other services that allow people to live safely in their communities with a degree of independence that is considered to be the least restrictive environment. Some people with physical disabilities are able to work professionally only if they have these services, which may be as basic as helping them get out of bed in the morning and into a wheelchair for the day so that they can work productively. The upshot is that having access to health care, which the Affordable Care Act has provided, is a matter of life and death. If this act is repealed, people with mental health issues and other physical health issues will not only not recover, but they will not be able to even survive in many cases. Paraphrasing Patrick Henry and changing the meaning a bit, I think we can say, give me health care or give me death. Recovery from mental illness is real and can only come about with access to health care. Let's join every other industrialized nation and make health care a right. Thank you. What do we want?
Health care!
When do we want it?
Now!
Who do we want it for?